Hey, it's Dr. Zenn. Congratulations to all of you who have been working with my suture videos. I love your comments and telling me how successful you've been at suturing and how much it's helped you. That's awesome. I've had a lot of questions from many of you as to, great, I know how to suture, but how do I pick the suture? So this is a little presentation I have for you that talks about suture material. I've given this particular talk to surgeons, to groups of students, and it's always amazing that people don't really understand the suture material itself. Oftentimes, people just use the suture that someone showed them to use or what was on the shelf. So I'm hoping you're going to learn a lot from this, and at the very end, I'm going to give you my tips as a plastic surgeon, what I think are the best sutures. And so we're going to go ahead and proceed with choosing the right suture material. So our objectives for this presentation and for my talk with you is going to be talking about not only the composition and the characteristics of the different sutures, but also then, like, how do you actually then make a decision based on those characteristics? So we're going to start really basic. Some of you, this may be review. If you're a surgeon, certainly you'll know a lot of this already, but I think you'll hopefully learn a lot. And if you're just getting started, we're going to start pretty basic. Suture comes as really two varieties. It can be a braided suture made up of a lot of little fibers that are braided together, or it can be a monofilament, meaning just one thread. And when you look at a suture and feel it in your hand, it's all going to feel like it's just one thread. So this is really almost at a microscopic level sometimes, and it's hard to tell whether it's actually braided or not. So let's talk about braided suture. So why would you want a braided suture versus a monofilament? Well, braided sutures, you can imagine, are these small little fibers twisted together, and we know through physics that by doing that and by having these little materials braided, that actually gives the suture more strength. We call that the tensile strength. Also, like a braided, like anything we see that's braided, they're also softer. It's more pliable. And so that's very enviable when we're suturing, to not have suture that's super stiff, that'll be nice and soft when we're using it. The other thing that's nice is when you take a braided suture and after you've passed your suture and now you're tying your knot, that knot itself will stick better. The material tends to hug, because of the braided nature of it, tends to hug itself. And so you'll see when you're tying knots, generally when I am suturing down and tying knots, I do 3 sort of square throws, like I showed you in the video, and that's usually perfect. Sometimes you'll find with monofilaments, because it doesn't have that same sort of stickiness to it, you'll need to put either 4 different throws or even more. So you'll often hear this term memory as well. Sometimes you'll pull suture out of the pack, and this is true of monofilament, where it literally stays like it's still in the pack, and you're trying to straighten it out, and as you're suturing, it's getting in your way. You see that less with braided material. That's more a characteristic of a monofilament. Well, I just told you why braided suture is so great. Why would you want a monofilament then? Well, a monofilament, as you can imagine, it's just one material going through. There's no braid to it. Because of that, it's super smooth, and as you pass a needle through, you should be able to tell the difference, whether it's braided or not, because it moves so easily through the tissue. So that's a huge advantage. Although sutures can tie down easily, there is that sort of slipperiness to it. And you need to be careful because it tends to be a little more brittle, less pliable than a braided suture. I often see beginners, as they're picking up their suture and grabbing it, they're using the needle driver to actually pick up the suture material. And if you look at that material where you've grabbed the clamp, you've actually now broken the suture a little bit or dented it. And you'll find while you're suturing that sometimes the suture just breaks out of nowhere, and that's because you actually grabbed it and caused that little deformity to it. So it's a disadvantage, but once you learn this, it's a nice smooth suture, so it's one of the most common ones that we would use for things like skin closures, and we'll go over that a little more detailed. The other sort of big difference between stitches are those that are absorbable or will dissolve versus non-absorbable or permanent suture. So absorbable sutures, there's basically 2 varieties. There's some older school sutures, sutures that are made from natural materials, and when they're inside the body, the way that they get dissolved or absorbed is through certain enzymes that are present in your tissues. So there's really an enzymatic process to break them down. Now, that's not true of most modern suture material. That's more of a synthetic material, and we'll talk a little bit more detail about that, because those are the sutures that we generally will use. Those are broken down by a process called hydrolysis, so they don't require any specific enzymes. It's just a reaction with water, and they'll start with a certain strength, and just by having contact with tissue will break down over time. So why would we want a suture that disappears? Well, if you think about it, you don't need to have a stitch there all the time for the rest of time, right? So we need stitches to hold tissue together wherever we're trying to get a wound to heal. And once it's healed and has strength, you theoretically don't need that anymore. So ideally, a stitch that was placed holding things together, if it disappeared later, would be better. And actually, we see this in general surgery and other surgeries that we do where we put permanent stitches inside the body. The problem with a permanent stitch is it never dissolves, it's always there, and rarely, like bacteria that generally naturally circulate through your body, if they actually land and get to this material, they can actually form an infection. And it turns out your body can't really fight infection into foreign bodies because there's no way for your inflammatory cells or your immune system to get in there. So sometimes we actually have to reoperate on people to go and get those stitches. So there's definitely an advantage if something can disappear over time. I can tell you also, this is the type of suture that everybody asks for. Anytime someone cuts themselves or we're suturing something up, they're going, you're going to use dissolving stitches, aren't you? And it's funny because I probably am not going to use dissolving stitches most of the time, and we'll talk about that. So they are certainly more popular. When we talk about a permanent suture, well, what's the advantage of that? It really is that the stitch itself is going to have more strength than an absorbable suture. A dissolving suture will have strength that disappears over time. A non-absorbable suture is just going to have the same strength all the time. And that's really important when you want something to stay closed. You want the wounds to stay together. So it's even better in cases where maybe it's injury or surgery where we've sutured something and now the next couple of days things are going to get swollen. That swelling will pull on your stitches, and so certainly a permanent stitch can tolerate that swelling better. So we'll do that in big trauma cases, for example, where we know there's going to be a lot of swelling. The other thing that's interesting is that these materials that we use, these permanent sutures, the body just doesn't react to them very much. So if you put a dissolving stitch in the skin for closing the skin, you actually may get a really big inflammatory response. You'll get a lot of redness around the stitches because the body is trying to absorb it. So although you don't have to remove it, that might be an advantage, you're also going to get a scar that may have these little red marks around it, or a really red scar, which nobody wants. So you'll see for permanent stitches, there's very little reactivity, so you can leave them in for 3 or 4 days. For some cosmetic cases, I'll leave them in for 2 or 3 weeks, and you just don't get a lot of redness to them. And they're holding the wound together as long as you want, and then you're taking them out. So actually, I wrote here that better for kids because, you know, the biggest mistake I see people in the emergency room, when people are sewing up kids, they're kind of fighting, they had a cut in their face, and you're trying to suture something up. Number one, the dissolving stitch may not hold long enough, so it may be a day or 2 later and they come back and things have broken open. And number two, you're going to get the worst possible scar because you're getting all this reactivity. Ideally, I would prefer to put a permanent monofilament stitch, and there's not going to be a lot of reactivity, and we'll struggle a couple days later in taking the stitches out. Any of my facial cosmetic cases, this is what I use because we want the best possible scar. So a couple of things we need to talk about for suture material. There's something called the tensile strength. So that's the actual strength of the suture that it can hold before it breaks. And so that's a measurement that's done by the United States Pharmacopoeia, and it's how we compare different suture materials. We also talk about an absorption profile for sutures that are dissolving because, you know, there's a certain amount of time when a suture is placed in the body, it has 100% of its strength, and then literally immediately it starts losing its strength as we have that reaction, either enzymatic or hydrolysis. And so what we'll see is it'll have the amount of strength that we need to hold the wound together, and then as it starts to go away, we'll see a little bit of coming apart or something that's not as strong anymore. So this is a characteristic that actually is super important. And we talk about failure, so when a wound is going to come apart, it can be a failure of the suture, but it also can be a failure of the knot. So how we tie our knots, super important. We've talked about squaring the knots in the video, and that's like really important so the knots are snug and will stay tied longer. But also the different type of suture material can affect how effective those knots are, whether it weakens the suture or whether it allows those knots to lay down beautifully. So you'll find that a braided suture just generally has a little more friction to it. So if you try to use it over and over again, you'll see that it's not going to be as strong. We also see that we like to use different diameters of sutures. So sutures that are really, really super thick, the knot can stay on longer, but then it's a lot of absorbing that has to happen or a lot of dissolving. And you'll see for like plastic surgeons and for like facial things, we use smaller and thinner suture. And so we have to then think about the strength and how those knots are going to tie down for this tiny little suture because it can break. So it's interesting, if you look at studies that have looked at sort of when wounds come apart, almost always where it comes apart is at the knot itself. So your technique of tying the knot is super important. And also we talked about, even when you're using your instrument, not to be tying a knot in a place where you maybe have damaged the suture material. I love this slide. This is always surprising to people. People will email me and ask, hey, is it okay to use a 3/0 suture for this? Or I want to use a 0. Like, it's interesting to know what those actual numbers mean. So you think about suturing has been around for a long time, 17, 1800s, probably even longer before that. But as it was being made industrially, the smallest suture made was called a 0. And then every time a stronger suture was made and a bigger suture was made, it was then given a larger number. So a number 1 suture, bigger than a 0, number 2, bigger than number 1, etc. And suture sizing goes all the way up to a number 7. As manufacturing got better and as we started using finer and finer sutures, because we actually get better results sometimes, especially cosmetic results, using very, very little suture material, we wanted thinner and thinner suture. And so once we made something smaller than a 0, rather than changing the whole classification, they decided, well, let's just call it a 00. And they're great. And then you made smaller than that, and it's like, we'll call that one a 000. And you can see from the chart, we're up to like 11 zeros, and it gets really confusing to have like a string of all these zeros. So we just simply refer to these as 2-0, 3-0, 4-0. And I think for the beginner or the novice, it's confusing because you would think a 4-0 is bigger than a 3-0 because 4 is bigger than 3. So anytime it has the dash and the O, it's actually heading the different direction. And I've placed here, get a sense of suture sizes. You think about the human hair, that's about a 7-0. And so we'll use 7-0 in some vascular applications. It's a common stitch that's used for coronary artery bypass grafting. You can see generally for the strength that we would need for a skin closure is somewhere between the 3-0 to 5-0 to 6-0 range. You can see for some of these really large sutures, they're for big abdominal, like muscular closures, or even like trying to close ribs in the chest. But we will, you do microsurgery, which is using a microscope to do the surgery, and I can hold up a 10-0 suture to you, and you won't even see the needle, and you won't even see the suture. They're so small. Only under a highly magnified field can you see this. So microsurgery is done at a very small level, and we'll do that for things like reconnecting tissues when people have digits amputated, sewing everything back together, reattaching ears, things like that. So that explains the numbering system. This is a busy chart. I guess what I wanted you to take away from this chart was, if you look sort of at the far left on top, there are some just naturally occurring suture, naturally occurring materials that sutures are made out of. Those are the absorbable natural sutures. And the next column over is, you see the synthetic sutures. And synthetic sutures can be absorbable or they can be permanent, right? And so the beauty of that is that you can make a suture with the characteristics that you want. And the other thing I wanted to show you in this slide here is, if you look at the bottom, that you take a suture like a vicryl suture, which is an absorbable suture, that at different periods of time they're going to have different levels of strength. And so if you ideally want at least 65% of the strength to kind of hold the wound together, if you look at the vicryl suture, you can see at 3 days versus 7 days versus 2 weeks, you're going to continue to lose strength. And I can tell you, I've reoperated on patients where it says that it should be completely absorbed by 2 months, 3 months, and it's 2 years, 3 years later, and there can still be some material there. So it's sort of like just a degradation curve. The suture material still may be there. It may have caused some scar tissue around it. It's just not strong anymore. There's another thing I wanted to point out. This is a suture card that our hospitals use. Different companies make this suture, but they all make the same types of suture. So there may be 4 or 5 different suture companies. Everybody makes a certain type of polysorb or vicryl, the same components. It's the exactly same material, maybe a little bit of a different processing. And what they've done is they've kept all these suture types in the same colored packages. So if you wanted to use a vicryl and they handed you a polysorb, you'd see the package was purple, and you'd say, oh, okay, it's the same. So, I know a Proline or a SurgiPro is going to be in the loop package. So you may notice this color issue. I think they've made it easier so you can substitute back and forth. Maybe companies that aren't as popular can sneak in and sell you some suture too. So let's just talk about some of the more common sutures that you'll see. From the natural sutures, as I said, these aren't used as much anymore. They're probably harder to make. I think a lot of surgeons are older. They've kind of done it this way their whole careers, and they just like using the suture that they use. So surgical gut is a very commonly used suture. It's called gut because it literally is made from small intestine, from cow small intestine. It can be treated with an aldehyde, so it feels, when you feel it, it feels like just a single monofilament, but actually it has certain strand quality to it. This suture is very temperamental because it's made of these natural materials, so it breaks pretty easily. I've seen it used still today, and people will like do bowel anastomoses and things in the body where they just want to reattach the mucosa part, the inside part of the intestine. There's no tension on it, they just kind of want to hold it together, and they want a lot of reactivity, so there's some scarring that helps the healing. You'll get a lot of scarring. If you put a plain gut in the skin, you'll see it gets pretty red pretty quickly too. So it's not ideal for a lot of skin applications. Chromic gut has simply just been treated differently. It's treated with a chromium solution, so it lasts longer. So what we see then is if we look at strength, a plain gut, because it's not as treated as a chromic gut, it's not going to have its tensile strength as long. Generally, it's for a few days, up to a week. So here, say 7 to 10 days. Whereas by having this extra process, this chromic gut can last closer to 2 weeks. And more importantly, the plain gut will disappear faster. The chromic has been treated to hang around longer. So that goes to the absorption profile. More interesting is really the more modern sutures, and these are the ones that you're going to use more often. So synthetic suture, interestingly, all the sutures share common building blocks. So there are certain monomers that are used to build sutures, and each of the monomers you can see in the chart here on the left side have different characteristics. And if you made an entire suture of glycolide, you may have really, really great strength. It has high strength, but also it disappears really quickly. It hydrolyzes quickly, and the problem is it's not flexible at all. So it'd be a very stiff suture that would have good strength, but it'd disappear really quickly. So really what you want to do is you want to try to mix these different monomers in ways that give you sutures that have different characteristics, that are stronger, longer, maybe disappear faster, they feel better in the hand. So what you'll see is that when you look at sutures that are commonly used, there are different combinations of each of these. And that's how synthetic sutures are made. And that's kind of how they get their different characteristics. So we can see here some of the more common sutures, and I'm going to actually go through some of these because I think it's helpful to think about, again, how you're going to pick your suture. So if we look at sutures that are absorbable and are braided, these are ideal because they handle well, they have nice flexibility, they're going to disappear, so you're not going to have them permanently. So I think they're great personally for like under the skin where we're trying to pull things together. Ideally, you need a good solid 2 weeks of things together before the natural healing and natural scarring process has good strength to a wound, so something that holds tensile strength for about 3 weeks is ideal. So Polysorb or Vicryl is the other company's name, is perfect for this, and you'll see this. I'll use this deeply to get the skin together, untie knots. Like I said, even though at 3 weeks it loses its strength, it can still be around for a fair amount of time, as you see, up to 70 days. The next sutures are also absorbable, but these are the monofilaments. Again, some monofilaments have better handling characteristics through skin, so I like these better in the skin themselves. Capricin is something that's very fast dissolving. It has the same sort of tensile strength as plain gut, if you remember, about 10 days. The beauty of these synthetic sutures, and I place them in the skin sometimes just to realign the skin perfectly, is that they kind of just disappear after a week. Hydrolysis has taken away that little internal part of the suture and just kind of falls off, and there's no real redness to it. So you don't get as much reactivity as we do with the natural sutures. Biotin is a great suture for running the subcuticular closure. I know a lot of you have commented that that's kind of the coolest closure that we can do. It's also the one that has no suture material that's visible in a scar, so it is a very cosmetic closure. That literally sits under the dermis, holds the skin together. Again, it has about that 3-week time frame, which is actually perfect for healing wounds. And then sometimes you need something that's a little stronger, so then you might choose a Maxon, maybe because it has twice as long tensile strength and can have good strength. And that might be in a situation where maybe it's a weight-bearing surface or a joint or somewhere where there's going to be a lot of swelling or there's injury and you just want to have that strength for a little bit longer. So there's reasons to choose these. Some of the non-absorbable sutures, silk again is kind of one of these old school sutures, but you'll see it around everywhere because it just works so well. I mean, it has a great feel to it because it feels good in your hand, it has good strength. This is the suture I love for like medical students and people learning to suture, just because It ties knots, it holds the knot really well. If you're pulling it too hard or doing too much, you're not going to break it as much. So it has great handling characteristics. I still use this really for drains and things like that where I know it's going to come out anyway, and it's just really easy to tie. Probably more commonly though, you're going to see two sutures. The first is nylon suture, so it's literally made of nylon material. It's monofilament, so it moves through the skin really, really well. This is the suture that has great strength to it. It's not going to have a lot of reactivity, so this is going to be a primary suture for closing the skin. And you think about the different types of techniques I've taught you, whether it's a simple running or a mattress suture, you're going to be using something like a nylon suture because you know you're going to be taking it out and it's going to retain that strength for it. Nylon comes in a braided variety, but honestly, it doesn't change the strength characteristics, so I don't know why people use it honestly. I think you're going to use pretty much just this monofilament that's not braided. So nylon is one, the other is a Prolene or polypropylene, which is SurgiPro. Also, it's a monofilament, it's synthetic, it's going to be there forever, it's a little reactivity. Honestly, the difference between these is one is black and one is blue. It's kind of the way I lay it out for patients. If I'm putting stitches on their face, I was like, do you want blue or do you want black? And characteristics otherwise are the same. So again, this is going to be the most common suture that you would use for stitching up skin. And you can make these sutures super, super strong. So there's applications in the chest where we literally used to use wire to bring things together because it had such good durable strength. So Ticron is one of these sutures. It's a polyester, so it's incredibly strong. It's not going anywhere. It's great for deeper applications inside the body where you just need something that's going to be there forever and have great strength. So before we finish, I did want to talk about needles as well, because when you pick up a package of suture, what you'll see is there's a lot of different choices. And if you think about the needle, there is sort of the pointy end, the point of the needle. There is sort of the body of the needle, and there's the swedge. And the swedge is where the suture material is going to be attached to the needle. Now, I told you in the suture videos, the place that you always want to grab the needle with your needle driver is the middle, is that body. Needles generally are going to be flat in that area, and it makes it nice and secure. If you grab it up by the swedge, it's a rounded area. Not only will the needle move, you can also just accidentally, the suture material can come out of the needle, and then you got to start all over again. Definitely don't want to grab the needle by the point. And I see this a lot in beginners. As you're passing a suture, the point comes through and you kind of grab it because it dulls the point. So the basic difference, I guess, that I would want you to know in the tip of the needle is that there are cutting and taper. Taper, obviously, by its name, is a smoother taper to it. A cutting actually has a sharp cutting edge to it. So if you're suturing in skin and you're going to use the stitch over and over again, you definitely want a cutting needle. A taper needle will be good for the first pass or two, and then you'll find it's just hard to get through. Taper needles are often used more under the skin for deeper tissues, for things like bowel and muscle and things like that. So keep that in mind when you're thinking about your needles. So in conclusion, if you think about what our goals were for this talk, we wanted to talk about the composition of our suture material, the characteristics, to give you a better sense of which suture you should be choosing. And now the sort of $1,000,000 question is, so which suture should I use? For what? So I know it's frustrating for you. What I'm going to tell you is that surgery is an art. So there is no exact right answer. You will see people use different things. If you could think of the ideal suture, it would, again, hold material together that you wanted, tissue to tissue, so it could heal and be strong. And once there was enough strength in that healing process, you would want that suture to disappear. And so that's the ideal, and you saw from the characteristics of the sutures that we have, like none of those are really going to be perfect for you. So you have to decide what you really want. And so really what we're going to highlight is for this strength is super important, and yeah, it may last a long time, it may be in the body longer, but we're going to live with that if there's any issues with that. And you will see some very accomplished surgeons doing the exact same surgery or the exact same procedure and use different sutures. And depends what specialty they're in, depends kind of how they were trained. And I tell you, experience is really big. There are areas where I have used a certain suture for 5 years in a row and I have a complication or a problem, and maybe something got infected or a wound came apart. Next thing you know, I go and change to something else. I go from a monocryl nylon to a Prolene, or a braided suture to a non-braided suture. And so we're kind of fickle that way, because a lot of it probably doesn't have to do with the suture material. It's how you're suturing and your technique. So I would just say understand, like when you're watching someone do surgery or someone's using something, ask, say, why are you using a 3.0 nylon here? You know, Dr. So-and-so uses a 4.0 Prolene for this. And a lot of times, don't be surprised they don't have an answer because it's just kind of the way we've always done it. But you should think about it because you're learning now and you should be using suture material that's suture appropriate for you. So I can tell you, as a plastic surgeon, I have very sort of firm ideas about what you should be doing, so I'll just go ahead and tell you kind of how I feel about things. Certainly braided absorbable suture is ideal when you're bringing suturing skin to bring that skin together. So taking the deeper fascia or fat or even the deeper part of the dermis, the deep part of the skin, because what we want is we want those two tissue planes together and held in place so that our final suture is not holding the skin together, it's aligning things perfectly. So like a Vicryl or a Polysorb is perfect for that, 3-week time frame, perfect. Certainly when we're closing things on the face, the outer closure of the skin, I've told you already, I kind of like nylon or Prolene for that. I think the scar is the best. Yes, I have to take the sutures out, and I'm telling you it's not a problem. So, you know, stitching things down, not overly tight, getting the skin together. If stitches start to get red, that's generally when I recommend taking them out. So if stitches in the face, I would generally say a minimum of 3 to 4 days. Generally leaving them for a week is perfectly fine. What about the subcuticular that we all love so much? So subcuticular, you could use a permanent stitch and leave it sticking out of the skin and pull it out. Generally what I like to do is if I'm going to do subcuticular, let's use an absorbable suture so that the patient never has to have stitches removed. Something like a Monocryl or a PDS, again, has about 3 weeks strength. The video I've shown you how you bury the knot and how you can run the suture and get a really beautiful closure. What you should definitely think about, you know, larger diameter monofilaments in areas that are going to bear a lot of weight and have a lot of stress to them. So you want a higher number. So you might use a 6.0 or 5.0 nylon in the face. If I'm fixing a skin over a joint or an elbow, I'm going to use like a 3.0. And I might still use a nylon because I want it to be there for a while. So areas that are mobile, like joints, and certainly areas where there's trauma or you expect a lot of swelling, I would never do a subcuticular. I think that's a big mistake. And believe it or not, even when like we're going to suture something up, if there's a lot of tissue damage or it's like infection or we know we may have to take these things out quickly, I won't even put stitches in. I'll just staple the skin closed. Thanks for joining me. I'm really excited for everybody for all the suturing that they've been doing. Please keep those comments coming. I love hearing about where you've been doing suturing and how it's helped you out, and other thoughts or ideas or questions that you have so we can do more helpful videos. Take care and happy suturing.